Welcome to our webcast, Improving Health Equity Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Rayane AbuSabha, who will discuss the health equity resources available at the Accreditation Council for Education in Nutrition and Dietetics, known as ACEND. Rayane is the Executive Director of ACEND. She oversees the processes and policies related to the accreditation of education programs that prepare students to begin careers as a registered dietitian nutritionist or a registered nutrition and dietetics technician. Key areas include education modules and standards, program review and accreditation decisions, and the collection, interpretation, and dissemination of data pertaining to student entry, program completion, and future needs for quality of nutrition and dietetics education. Welcome, Rayane.
Thank you, Barbara. Thank you for having me today.
Oh, it's my pleasure. So tell us about the Accreditation Council for Education in Nutrition and Dietetics.
Certainly. So as you just mentioned, that ACEND does accredit nutrition and dietetics programs. We have close to about 620 of them, but they're at different levels. We have some associate degree programs that lead to the diet technician credential. We have bachelor's degree programs. And then we also have our graduate degree because dietetics now has moved to the graduate degree. So, we have, our dietetics preparation is either a coordinated program that includes the practicum with the education, or and those are together, or we have them as a bachelor's degree, master's degree, and then having that practicum separately. So lots of different type of programs. We also have some international programs with ACEND. The mission of ACEND really is to make sure that the quality of the nutrition and dietetics education program, and most importantly, to advance the practice of the profession of nutrition and dietetics. And our vision is truly to have excellent nutrition and dietetics education program. So one of the big things that that ACEND strives for is protecting the public, and part of the protection of the public is protecting the student. So a lot of what ACEND does and works with our programs is to provide support for our programs on how they can support the students, support the faculty, so that everybody has a good experience in nutrition and dietetics programs from wherever they come from.
Oh, that's great. I didn't realize that you had a graduate degree program. Is that fairly new, or has that been around for a while?
Yeah, so ACEND started the graduate degree as a pilot in 2016, and we started to work on it way before then, but they were available for adoption, and that because we are in preparation since dietetics moved to the master's level, we were researching the quality of the master's level dietetics programs, and we made them sort of a competency-based programs, not true competency-based. So they've been running for quite a while, and they are extremely successful.
Oh, that's great to hear. And probably popular too.
Yeah, we have about 88 of them. And yes, students, they definitely are the ones that don't lack as much enrollment. For sure, their students like them.
Oh, that's great. So how is ASCEND using the free anti-racism module, which was funded by the Josiah Macy Jr. Foundation?
Yes, absolutely. So ACEND in 2020 developed, had a new web page, part of ACEND, that is, promoting engagement and connection and inclusivity, and has a lot of webinars on to support our programs and our students, and also our dietitians who are in the community, to support them in how to create an inclusive and respectful environment for everybody, for all the students and all the faculty that we have. So on that webpage, we provide a lot of resources for our programs, our faculty, our dietitians, anybody can use them. And so we have that your module is sitting on that web page and can be linked directly from that web page. So it'll be just a perfect place for it.
So you mentioned that you have other resources available on that web page. Could you expand and tell us a little bit more about what other resources that you have?
Yeah, of course, we have a lot of resources on that webpage. We've been working on it for 3 years, providing a lot of information. But the most important thing are our webinars. 3 to 4 times a year, we provide a webinar to our faculty, specifically on diversity, inclusivity, engagement, access, all of that. And so we have a series of webinars by experts in dietetics or outside dietetics that are posted on that webpage. With these webinars, specific case studies, specific support on how to deal with students. And they vary and range from, like we said, anti-racism. We have a couple of those too, to microaggressions, to talking about supporting LGBTQ students. We just had this morning one webinar on disability, which will be posted probably in the next couple of days for our disabilities, for programs to deal with students who suffer from any disabilities. And then we have also, we're looking soon to provide a new webinar on weight inclusivity. So we're keeping thoughts on how to provide more webinars so that our programs can support different audiences, that they can make the programs very accessible to them.
Mhm. Now, these programs sound really great. Can they be used by other organizations, or are they only for ACEND members or people associated with nutrition and dietetics?
No, absolutely. Everything that ASCEND does is available to the public, other than the specific, things that are specific to our program directors. But all of these webinars, every single one, is sitting on our website. They're recordings. You can listen to them. They vary from an hour to an hour and a half. And we have the PowerPoints in PDF formats that are available to you to access. So they're available. We would love anybody to use them and benefit from all the hard work that we've been working on that information.
So I'm assuming this is free then and not behind a paywall.
It is all free.
Yeah.
ASCEND tries to make everything free. We
Oh,
want we want universities and programs to be accessible and support students. We're happy to support them any way we can.
oh, that's great. That's great. Thank you for that, Rayane. So you mentioned quite a few things that you have. Are you finding that any are particularly more popular resources or tools than perhaps others?
Yeah, we find usually that the specific webinars that really give tips are very popular, but also whenever we make them different. We did the LGBTQ one that was very different. You don't find a lot of this information on around. So I think that one was a very popular one because it helps people. It's a place to get that information that you don't find everywhere else. And then we did the disability. I expect that one will be very popular. But most of all, we have a couple of webinars that are case studies where we talk about how a student suffered either from acts of racism or from some acts, a small act of microaggression. One was against religion. We do all of these case studies, and then we provide the words, the behavior, how to respond. If you're an ally, how to support and support the individual who's been victimized. So we provide a lot of that information, and those, I believe, are some of our strongest webinars.
So it sounds like it's very practical advice, I should say.
Yes, absolutely. I think after a few years of giving a lot of definitions, we realized we needed a little bit more because that's what our programs were asking more. The faculty kept asking, like, could you tell us how to do this? Could you tell us how to do that?
And Are the examples that you use real life, or are they ones that you have created?
Well, that's a great question. Actually, what happened, our speaker, who's phenomenal, uh, uh, they posted a call out to students, faculty, and programs in nutrition and dietetics to share their stories. And so the stories were, of course, de-identified, but they were the case studies were true case studies that actually happened in real life.
Oh, wow. That's important, I think. Yeah, that they weren't created. So do you have any plans for future resources, and what might those be?
Yeah, I think we continue with our work on providing more and more information and widening the field because we started so much at the beginning with racism, ethnicity, all of those, and then we realized, well, we have a lot of other marginalized communities too. So we did the LGBTQ, we did disability today. We're planning another a webinar for disability. And I think this one is going to give specific tips on if you were in a practicum somewhere, how do we try to help the dietitian to work with a student who has the disability. And then that will be coming in the fall. And then after that, I believe next year we're working on weight inclusivity because as you know, in dietetics, that could be a major issue. So we will be talking about how faculty can speak to students especially when you're giving, when you're giving a talk on anorexia or a talk on bulimia, or when you're talking about the impact of a disease on malnutrition. All of that, I think that the faculty will be really looking forward to those information. So far now, those are the topics that we are providing.
So what would you recommend to anyone who's embarking on a journey to provide health equity resources for their organization? Any tips that you would like to share?
I will share the tips that are from my experience. I think after doing 3 years of inviting speakers and them speaking to us, I noticed that the speakers often tend to use the majority of the time defining the concepts. And we were, no matter how different the topic is, we were just learning about definitions and definitions of the same topics, the same context, things that you can do in Wikipedia and find them. And I realized later on that that is not what we needed. We needed practical advice on how to address situations that we are uncomfortable addressing. So now, every time I meet with our speakers, I'm insisting that we need case studies and we need you to tell us tips and ways on how to address it. How do I behave? What do I say? What should I not? What I should not be saying? What is the best way to address different situations? So I think this is how ACEND is moving because of we learned from the past and we're trying to improve the future, I think. But the tip is really work on learning how to do it or helping people on how to do it, what to say and what to do.
Very practical. Yes. So is there anything that you would like to share before we wrap up?
No, I just want to talk about just about in terms of the practical. You can tell a faculty everything that they know about definitions. That's not going to help them try to support the student when a preceptor in the field is microaggressing against the student. So that faculty needs to know how to address it. Or an intern, how to support her fellow intern who has been microaggressed on. So I just want to say, these practical things are so helpful. And thank you for so much for doing this. I think it's just such a beautiful project that you're working on. And ACEND is here to support you and support our students.
Oh, thank you so much, Rayane. I really appreciate that.
Thank you.
You've been listening to Dr. Rayane AbuSabha talking about the health equity resources at the Accreditation Council for Education in Nutrition and Dietetics on our webcast, Improving Health Equity, Resources and Solutions. I'm Barbara Lewis. Thank you for listening.